Good evening, everyone. Welcome to our virtual town hall. We'll get started in a few minutes.
Good evening, everybody. My name is Dina Diorio, and I am the Mecklenburg County Manager, and I want to welcome you to the Mecklenburg Board of County Commissioners COVID-19 Recovery and Renewal Task Force Virtual Town Hall. The Board of County Commissioners created the task force in June of 2020 to have a group of community residents that would really help the county understand what we needed to do to bring our county back and to create the resilience in our community that would help us move forward and make us more resilient in the event this ever happened again. And so what they've asked for via resolution is a group of people to develop comprehensive recovery and renewal plan of action that will be presented to the Board of County Commissioners, and it'll be covering the following substantive areas: access to health care and eliminating health disparities, mental and emotional health, economic recovery, nonprofit recovery and human services, education and childcare, working families, housing and homelessness, jobs and workforce development, food security, and arts and culture. And the Board of County Commissioners took applications, and they convened a group of community members who have been working actually since September to start working on these action plans. The task force is chaired by Victoria Amramovich from the Central Regional Council and Dr. Jerome Williams of Novant Health. And we've currently separated into 4 subcommittees. There's a health subcommittee, there's a public and government services subcommittee, there's a community and economic development subcommittee, and then there's the ad hoc committee. And this town hall is being brought to you on behalf of the ad hoc committee that was convened to try to bring forward information and understanding to the community while the task force was putting together their long-term action plans. And so we are very pleased to be here today. I do want to recognize that we do have a few of our county commissioners on the call tonight. We have Commissioner Laura Meyer is with us from District 5. We have Commissioner Rodriguez McDowell from District 6. I see Commissioner Lee Altman, who was one of our at-large commissioners. And I do believe that Commissioner George Dunlap, our chairman, also registered to be on our town hall tonight. And if he is here, I want to welcome him as well. And if any of my other board members are here and I don't see you, please speak up so we can make sure that you're properly recognized. With that, I'm going to turn it over to Sam Smith, who is a member of our task force. He's also the lead of the Public and Government Services Subcommittee, and he is going to introduce our panelists. Sam. You're muted, Sam.
All right, can you guys hear me now?
Yes.
Perfect.
Sam, you've muted yourself again. Okay, so why don't I start by kicking us off, and while Sam tries to get himself unmuted. So the topic for tonight is COVID-19 and the impact on our smallest residents. And so we are joined tonight by Janet Singerman, who is the president of Child Care Resources, Inc. We have Trinisha Dean, who is the executive director of our MEC Pre-K program. We have Dr. Elise Pugh-Lilly, who works with us at the Department of Social Services and leads our behavioral health division. And we have Dr. Gavanya Hunt from the Black Child Development Institute, who is very nice to join us here tonight. And with that, we are going to start with, I'm not sure who's kicking us off, is it?
I think I'm back, Dina.
Oh, good, thank you, because this was your part, so I don't know if I'm...
All right, I do apologize about the technical difficulty, but just very quickly, I just want to thank everyone for the opportunity to be with us this evening as we talk about this very important conversation on mental health, child care, and family services. I am going to introduce our panelists, but before I do that, I do want to thank our panelists for their willingness to be on this call this evening, to be thought leaders around this conversation, and I'm certainly looking forward to a great conversation this evening. So as I introduce our panelists, I'm not introducing them in any particular order. And after I introduce our panelists, they each will have about 10 minutes to do a short presentation. And then after the presentation, we'll go into the Q&A portion of today's town hall. The first panelist I'm going to introduce is Dr. Govind Hunt. Dr. Hunt is the founder and owner of Govind Hunt Staff Development, LLC, and Critical Curriculum Consultant, an agency that provides early education professionals with training and technical assistance. In addition, she is the president of the Mecklenburg Child Care Association, the president of the Black Child Development Institute in Charlotte, and a board member for the Charlotte Bilingual Preschool. Dr. Govind Hunt has a Master of Education in Curriculum and Instruction, a Master of Arts in Teaching, and a PhD in Early Childhood Education. She takes pride in learning how systems work and how culture and cultural competencies drive many of these systems. The next thought leader is Trenisha Dean. Trenisha served as the Executive Director of Mecklenburg County's Pre-Kindergarten Program, also known as MEC Pre-K, helping to bring free, high-quality pre-kindergarten to eligible 4-year-olds in Mecklenburg County. A native Charlottean, a two-time graduate of UNC Charlotte, Trenisha holds a Bachelor of Arts degree in Child and Family Development, a Master of Arts degree in Teaching Child and Family Studies, in addition to her birth kindergarten license. Before joining Smart Start of Mecklenburg County in 2018, Trenisha served as Program Manager for YMCA of Greater Charlotte at Howard Levine Child Development Center at Renaissance West. Trenisha brings 20 years of knowledge and experience to the early childhood field and pre-kindergarten sector. Our next thought leader is Janet Singerman. Janet currently serves as the President and CEO of Child Care Resources, Inc., headquartered in Charlotte, North Carolina. Child Care Resources, Inc. has served as the administrator for Mecklenburg County's Child Care Subsidies Program since its founding in 1982. Currently, Janet's organization administers over $70 million of child care subsidies funds through its contract with the county and is the grantee for Early Head Start. In addition to her role as Child Care Resource, Inc., Janet also serves on Governor Cooper's Early Childhood Advisory Committee and the Governor's Education and Nutrition Work Group. Janet previously served on the board of director of Smart Start in Mecklenburg, Union, and Cabarrus counties, the NC Child Care Coalition, and as the chair of the United Way of Central Carolina's Council of Agencies Executives. And last but not least, Dr. Pugh Lilly. Dr. Pugh Lilly currently serves as the Division Director for Mecklenburg County's Department of Social Services, also known as DSS. At DSS, Dr. Pugh Lilly oversees the division responsible for contract management, nurse case management, and clinical consultative services supporting DSS human services operations. Dr. Pugh Lilly holds a doctorate degree in philosophy, a Master of Arts in Psychology, and a Bachelor of Arts degree in Psychology. Prior to her current position at DSS, Dr. Pugh Lilly served as the Deputy Director Psychologist at Atrium Health. All in all, Dr. Pugh Lilly has over 19 years of combined experience in teaching, clinical, supervisory, and administrative experience in the fields of psychology and behavioral health. So again, I want to thank each of our panelists, and I will allow each of you 10 minutes to introduce yourself. I will start with Dr. Govind Hunt.
Awesome. Thank you, Sam. Thank you all for the opportunity to be here and to share and to learn with everyone, with our community. I'm going to start by sharing just a little bit of information about the Charlotte affiliate of the National Black Child Development Institute. We've been here in Mecklenburg County serving for quite some time, and I've been super excited to do so. We can't see that screen, Sam. Thank you. So I'm going to start off by sharing a quote with you before we actually get into what BCDI Charlotte does, because I want to remind everyone that, or let everyone know that you won't hear us use the term at risk right? When we're having these types of difficult conversations. And so that quote simply reads as being labeled at risk is like being voted least likely to succeed. For where there is no faith in your future success, there is no real effort to prepare you for it. And because of that, next slide, we choose not to use that term. And because of that, we actually roll our sleeves up and dive deep into the work of our mission. So for 50 years, MBCDI has actually been committed to the mission to improve and advance the quality of life for Black and Brown children and their families through education and advocacy. Next slide. BCDI Charlotte is one of 27 affiliates across the country. We actually just celebrated 50 years, so we're super excited about that because we're one of the few grassroots organizations that was birthed out of the civil rights movement that is still out here fighting on behalf of our children, our families, and our communities. Next slide. One of my colleagues recently reminded me of this quote in a presentation that he did a few weeks ago at a launch of another initiative that we did here in Charlotte. And this education remains one of Black communities' most enduring values. It is sustained by the belief that freedom and education go hand in hand, that learning and training are essential to economic quality and independence. And that's from one of our favorite authors, Marian Wright Edelman. Because we believe in the words that she spoke, we believe in these words that she wrote. Next slide, please. Because we believe in everything that she stands for, here in Mecklenburg County, BCDI Charlotte chooses to focus in several areas. The work that we do in Mecklenburg County actually fall under family engagement, literacy, early childhood education, policy and advocacy, health and wellness, and child welfare. And I'll just share just a little bit about some of these initiatives. Our family engagement program is one that's very unique, and we're super happy to execute it here in Mecklenburg County, where we walk families through a very unique curriculum that lifts the voice and the strengths that families bring to the table. It's actually culturally relevant and responsive, and it actually is designed and is delivered with the fact that parents are our children's first and most important educators and lifelong advocates. And whatever it is that they bring to the table is good. It's good enough to be able to lift up and help advance our children to where they need to be. And it's also good enough and positive enough to be lifted and be spotlighted and used as in partnership with our family child care providers, with our child care professionals, with anybody out there that claims to be working on behalf of children and families. Our literacy bucket that we function under in Mecklenburg County falls under what we call Read to Succeed. And that's where we focus on putting culturally relevant and responsive literature into the hands of Black children and to the households of Black and Brown families, because representation matters. So we focus on distributing books, as many books as we possibly can, so that children have the opportunity to share into the love of reading, so that their families have the opportunity to really advance their literacy skills in their homes, because we know that they have the power and the capability to do that. Under early child education, we focus to lift up the voices of our early education community. Those would be the voices of our providers that have who have been superheroes throughout the course of this pandemic, right? Even before this pandemic, they've been superheroes. But we try to do everything that we can to make sure that they have a voice, that those who don't feel like they're comfortable enough to pull up at these types of tables and these types of difficult conversations, that we represent them as best as we possibly can. And that's the same thing with policy and advocacy, especially around things that talk about preschool, the disproportionate number of preschool suspensions and expulsions that happen across the country, and then even kind of drilling down to see what's really going on the ground here in Mecklenburg County. Our health and wellness is something that we're also very proud of, and we deliver something called Good for Me. And that's where we actually lift up our child care centers and providers that want to help their families use a culturally based curriculum that talks about health and wellness. So eating habits, growing gardens, and teaching their children that just because their skin is brown or Black, Sam, that they don't come from high blood pressure or diabetes automatically, because there are some conversations out there that use deficit language like that and like us to believe that. So we actually use that curriculum to work with our providers so that they have an opportunity to share this with their families. And of course, all of these initiatives that we exercise here in Mecklenburg County have to do with child welfare. We've been super excited and very fortunate enough to be embraced by our community. We will continue to fight for our community. We'll continue to do everything that we can to lift up the voices of our families, to support our children, and lift up the voices of our early education providers. Next slide, please. So my colleague, he's very big on quotes, and this is another that he lifted up recently. We do this because of exactly what James Baldwin said. Not everything that is faced can be changed, but nothing can be changed until it is faced. So BCDI Charlotte is here to have very difficult conversations, to ask hard questions, and although it's super uncomfortable for many, we are going to continue to do that because we believe in our mission, and we believe that if we don't call things what it is, especially the effects, the aftermath of this COVID-19 pandemic, everything that's been challenging for our early education system, then we can't fix it until we call it what it is. So BCDI Charlotte is very fortunate. We're blessed. We are happy and consider it a privilege to be able to serve in Mecklenburg County. Next slide, please. So check us out. If you want to learn more about what we do and how we do it and who we work with, you can find all this information on our website. And I think that was less than 10 minutes, Sam.
Yes, thank you. Our next thought leader that will dig a little deeper in her work is Ms. Dean.
All right, thank you. And I'm watching the clock, Sam, as well. Definitely want to recognize my fellow panelists. When you speak about Mech Pre-K in Mecklenburg County, it definitely takes a village. And Dr. Gohan, she raised her hand back in August whenever the decision was made for us to go in person and said, what can we do to help and support? She went to bat and got thousands of face masks for our children. So thank you for the work that you're doing. Janet Zingerman, again, you are an advocate and has been for many, 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 many years. So thank you for your work, and recently started working more with Dr. Fu Lily. So again, thank you and recognize you guys for what you're doing. Mech Pre-K. So before I even get started with coming on board with Smart Start and Mech Pre-K, I have to go back to my my start in early education. Charlotte Tan, went through the community college system with Central Piedmont Community College, got my associate's degree in transition on. I actually spent a lot of my time working in a surrounding county, administering at the time the state's pre-K program. It was called More at 4, now it's called NC Pre-K. So spent several years working in a county that my tax dollars didn't go toward. Did a lot of work in innovation with becoming the model for what pre-K looked like during that time. We had a partnership with our local school system, the county, and all of our teachers that worked in our program, whether they were housed in public schools or housed in childcare centers, they were actually public school teachers. So that was something that was very unique to our partnership and what we did. Again, I'm still glad to hear of some of that interest throughout the state. Transition to the community college. Worked with South Piedmont Community College for many years in the early childhood sector. And that's when I really got a true passion for supporting teachers. Our teachers are boots on the ground of what they're doing. So what can we do to help and support and further their education? And I feel going from the community college system to transitioning on to get their bachelor's degree and later on to get their licensure. During my time in Union, I actually worked for Smart Start in Union County or was funded through the program, so very familiar with that. So when the opportunity presented itself to come and work for Mecklenburg County Smart Start, I jumped right on it. I'm very familiar with that, and I feel like it was a full circle moment from when I got my career started in the field. Coming on board in July of 2018, it was a very quick start with Mech Pre-K. The vote went through, I think, in June, and we had to quickly open up 33 classrooms in the county. So from locating the children, to identifying their providers, to house our program and supporting them with hiring teachers, getting the materials together. So lots of work went into that. And I have to give credit to our providers, our directors, our owners. They are boots on the ground, and they were able to assist in getting that off the ground. I have to shout out, you'll hear me say this multiple times tonight, we have no program without our teachers, not at all. So when we support our teachers, you're holistically supporting that whole family. So happy to still be that support, with supporting them. And we were able to receive additional funding from the private sector in Mecklenburg County to assist with furthering that education pipeline. We quickly transitioned to our second year in 1920, and we're like, all right, this is a full year. We're going to hit the ground going. We opened up 36 additional classrooms on top of the 33 from the previous year. And some community partners think that, oh, okay, well, you attended by 600 kids the previous year, so you're just going to add on a few more. Our children graduate. They transition in June and go into kindergarten, so we have to start that recruitment effort over. And we're really big in ensuring that we are serving families and children that have the greater need. Each year, we do increase our income eligibility to diversify our classrooms, but still targeting the children that have the greater financial need as well as developmental need. In our second year, we're rocking and rolling 7 months into the program, and then March happens, and we had to make a huge pivot with COVID. And then I have to again give credit to our MEC Pre-K staff as well as our teachers, because they made that pivot. They said, what can we do to still ensure that our families are being supported, our teachers are being supported during that time when we didn't have those platforms necessarily set up for virtual instruction. So again, they went to bat with picking up the phone. If that means I have to pick up the phone and call, text messages. They were going to their families' home during COVID and making sure the food was provided. So again, we have a huge support for what we do in the community with the system that we have, as well as with the families that we serve. I again alluded to earlier the education. Our private sector, and thanks to Dina and her leadership, raised over $6 million to support and build that pipeline of educators. We know in the world of education, there's lots of turnover in our field, but what can we do to build that pipeline? If we're opening up 36 classrooms each year, where are the teachers coming from? So really investing in them in the early stages, walking them through that program, and then transitioning them on and creating a pipeline and a pathway for them to further their education. This year, we started off the year, I'll say with a little controversy, with making a decision to provide in-person instruction. I support that decision, but we did hear from the community. We wanted to hear from our parents. We wanted to hear from our partners, as well as our teachers, and we collectively took that information in. We met with our local and state health officials. Dr. Meg Sullivan and the health department has been tremendous in supporting us throughout this whole year with providing webinars to our families in both Spanish and English. And also coming in during our professional development and teacher work days and providing COVID updates and Q&As for our teachers. So again, that speaks to that support system. With our in-person instruction for this year, we did put in some safety precautions with reducing the classroom capacity to no greater than 9 children in those classrooms. And again, we know that our families were nervous. We know that our teachers were nervous, but I think the one thing that we did a great job is communication, communicating and being transparent about what it looks like. Families were not able to come into the classroom and see see the setting, see that parent board. So making sure that we supported our teachers and our providers with communicating that information out to our families. Masks, little ones walking around with a mask all day, or teachers, but it became second nature to them. Our teachers probably struggle a little more with it than our actual children with that. So super glad to be on the second half of our program year. We're starting to see a little bit of light. Vaccinations are out in the community, and our teachers are getting those. And again, thanks to the support of CCRI and Smart Start with setting up those drive-through events for the childcare for our childcare teachers. So we're looking forward to ending this year, yet another year, but still providing the support. And we're looking into some summer enrichment opportunities for our children. as they transition, into the summer, and then we start our next program year. Also want to mention, we are super excited. We released our new online database on March the 1st. So we have been supporting families going to the community, providing paper applications, coming into our office to apply. But when you speak of access, we have yet gave another access point or options for families to complete applications. So glad that we've gotten several hundred applications or accounts set up for families applying. So that's just another option for families to enroll in our program. And going into, as we are still in a current program year and starting another program year, we do anticipate having to really go back and re-educate families about the need for early education. So we'll be doing lots of grassroots efforts as best we can going into the community. Our very first year, we had a street team put together going door to door. So we'll be doing a lot of those efforts in the community. So feel free to support us in any way that we can, but super excited to be, again, a part of this program, a part of this initiative, and the vision that the county manager has and our commissioners have for universal pre-K, giving every child a fair, equal opportunity of early education prior to going into kindergarten. Thank you.
Thank you, Tanisha. Next up, I'll have Ms. Singerman. I think you're on mute. I'm just happy to know I'm not the only one with challenges.
Great to see all of you tonight and my fellow panelists, and I'm really honored to be here tonight to talk about child care in Mecklenburg County. I'm really not going to talk about child care resources so much, although we've been around nearly 40 years working to advance access to high quality affordable education. So please visit our website. But I want to do tonight is to talk about childcare and the childcare landscape in our county, which has largely remained open and providing in-person care and early education throughout the pandemic. This wouldn't have been possible without the incredible and heroic efforts of thousands of essential frontline family childcare providers and childcare center owners, directors, teachers, and staff. They are the reason childcare remained open, and they are the force behind our workforce. For the past year, these extraordinary individuals have really risked their own well-being to continue to serve children and families. Many have done so without access to health insurance, and most earned inadequate and low wages for their essential work. In fact, childcare professionals are among the most poorly compensated of all essential workers. I ask you to consider the difficult daily decisions faced by childcare program operators as they struggle to decide whether or not and how to remain open. From day to day, they didn't definitively know how safe it was to work, which staff would be willing and able to work, which children would attend, and whether it would be economically viable for their programs to open or remain open. Attendance and revenue plummeted as families lost jobs, became underemployed, worked from home, and grappled with health and safety concerns. Childcare staff became less available as schools closed and their own children were at home for remote learning. Childcare operating costs increased as health and safety guidelines were enhanced, requiring additional staff and supplies for cleaning, sanitizing, and daily health checks. Yet despite these many challenges, childcare remained open. The selfless contributions of our childcare workforce are really significant and worthy of our gratitude. So I really want to ask you to join me in paying tribute to these exceptional folks and thanking them for all they have done to keep children safe and secure and learning, to support families and employers by making it possible for parents to work outside the home, and to undergird the economic recovery of our county, our state, and our nation. Imagine you're curious about what the impact of COVID-19 has been on our local market and what it looks like 1 year into the pandemic. And while people who know me know I can talk forever with data, I only have a few minutes, so here are the cliff notes. First, the good news. The number of licensed childcare programs and spaces across Mecklenburg County is largely unchanged and still at higher quality levels in terms of star ratings. Comparing February 21 to February 20, net losses for childcare, licensed childcare were far less than anticipated. In fact, Mecklenburg retained 98% of its licensed childcare programs. We now have 568 programs and 99% of its licensed spaces, a net loss of only 633 spaces. so against more than 49,000. And 90% of our childcare programs are open. 97% of our centers, 436, and 100% of our family childcare homes. We have 120 such homes. Our market remains predominantly high quality, with 71% of our programs and 76% of our spaces at the 4- and 5-star level. It's interesting to note that throughout the pandemic, family childcare home operations were more consistently open and enrolled than centers, as families seem to prefer smaller settings with fewer children, adults, and families served. And for the first time in 20 plus years, Mecklenburg County and CCRI has no waiting list for childcare subsidy. No waiting list for childcare subsidy. While this is good news for families needing help to afford the cost of childcare, reduced subsidy use speaks to public health concerns and decreased parental employment. And CCRI is now marketing the availability of subsidy. But here's the really troubling news among the troubling news items. Childcare enrollment has dropped to 50% of pre-COVID levels. While nearly 30,000 children were enrolled in childcare last year, now under 15,000 children are enrolled. And only 30% of our open licensed childcare spaces are enrolled right now, compared to about double of that pre-COVID. The number of children receiving childcare subsidy is down by nearly 1,800. The percentage of total enrollment comprised of children receiving childcare subsidy has actually increased from 26% to 41%. So while subsidy is down, the percentage is higher. And that's because many private pay families have withdrawn from childcare during COVID. There has been a disproportionate loss of childcare in areas that are lower income. 13 of our 14 net program loss countywide were in the Crescent. We lost 7 centers and 6 homes there. And when programs close, particularly in lower income neighborhoods, we are always concerned about whether they'll be replaced. And while we expect enrollment to improve, continued low enrollment will further weaken and put at greater risk the already fragile childcare system. It's really important that in order to sustain the system as well as we have, there were a lot of supports put in place at the federal level, the state level, and the local level to stabilize childcare. And those were payments based on February 2020 enrollment versus COVID enrollment, an emergency childcare subsidy program for essential workers, waiving parent co-payment fees to access childcare subsidy, creating bonuses for childcare staff for a few months, making operational grants to programs to offset their childcare program losses. Our state's approach to childcare and public pre-K stabilization were exceptional, and locally, as Trinisha said, the county manager and the Board of County Commissioners aligned its childcare and pre-K strategy largely with the great work the state has done. But the childcare system was fragile before the pandemic, and despite all of these supports, is even more so now. Childcare programs cost more than most families can afford to pay. The average annual cost for an infant at a 5-star center is over $12,000, more than a mortgage or rent, and more than a year of tuition at a 4-year public college. Fees are rarely enough for program operators to pay even adequate wages for their staff and keep their programs financially viable. A few Mecklenburg-specific data points that were recently released about our workforce is that childcare professionals, no surprise, are mostly women. 94% of our directors, 98% of our teachers, and 99% of our family childcare providers. Our childcare professionals are predominantly of color, 70% of directors, 73% of teachers, and 80% of family childcare providers. Our childcare professionals earn low wages, on average, $21.63 for directors, $13.75 for classroom teachers, and $10.48 for family childcare home providers. And the average age of our childcare workforce is rising. Directors are 48, teachers average age of 44, and family childcare providers average age of 54. During the pandemic, teachers could earn more on unemployment than by working in childcare. And as a result, we lost many trained professionals and now have an even more dire workforce and pipeline issue than before. 1 year into the pandemic, our childcare workforce is smaller and more stressed as our professionals struggle to make financial ends meet, manage different children attending each day and COVID classroom closures, maintain social distancing while nurturing and engaging young children, and deal with their own anxiety and wellness while helping to alleviate children's anxieties, all while feeling a bit undervalued and wondering whether their employment is secure and their future is in childcare. So where do we go from here when families can't afford to pay more for childcare, staff can't afford to earn less, and program operators can't charge more and stay in business? I think the way forward is that we have to build childcare back better, and now is the time to do so, when childcare is finally beginning to be recognized as essential. Childcare is and should be recognized as a public good, making it possible for parents to work and achieve economic self-sufficiency while their children are safe, nurtured, and better prepared for school. Now is the time to address the systemic isms of our community and our state and our nation, whether that's around sexism, wages, inequity, racism, and classism that have held back women and children and families and our childcare system. And if not now, when? We must create a stronger, more just, and equitable childcare system for all those who rely on it and deliver it, and one that does not merely survive and get by at the expense of its workers. Mecklenburg County is leading by example. Trinisha's talked about it. I think Devanya talked about it with its investment in early childhood education, $20 million for childcare subsidy, funding for universal pre-K, and funding to reduce barriers to higher education for our early childhood professionals. And at the federal level, there's legislation that just brought $336 million for childcare into our state, and the American Rescue Plan passed last week by Congress will bring $1.3 billion for childcare to North Carolina. Also, the federal changes through that legislation in child tax credits and dependent tax credits will move more children out of poverty than ever. So I urge us to move forward now with common purpose to build a stronger and more just childcare system for all those who need it, and by so doing, build a more just and equitable future for our children, for women, for early educators, for families, and for our nation. Thank you.
Thank you, Ms. Ingman. And our last presenter is Dr. Pugh Lilly.
Thank you so much, Sam, for that lovely introduction. And I also just want to thank County Manager Diorio, the Board of County Commissioner, the COVID-19 Task Force for this opportunity to present this evening. And I just want to say that I am so fortunate to be in the presence of my fellow panelists, all of whom are consummate professionals in their respective areas. Janet's presentation was a really nice segue into what I'd like to share during my 10 minutes with you this evening. I really want to talk to you a little bit about the national landscape right now, and then also what effect this has had on our smallest citizens, as well as those women and minorities that Janet was just talking about, who are responsible for caring for our littlest citizens. Next slide, please. As Sam mentioned, I am a psychologist by training, and I oversee a small division within the Department of Social Services that provides a range of different integrated health services for the other human servicing divisions within our department. And we also support some other county departments as well. So given my background as a behavioral health professional, I would like to spend my time today really talking about how this pandemic has affected us as a nation with respect to the mental health and the emotional toll. So I'm going to provide just very briefly some statistics and some information that was gathered through some national surveys that were conducted in 2020. And then also I'd like to spend just a few minutes, and hopefully I can keep this to 10 minutes, reminding this group, and I'm sure that most of you are well aware of the concept of adverse childhood experiences. I just wanted to kind of give us a little refresher about that and how that definitely dovetails and connects to our experiences now managing this global pandemic. And then talking more specifically about how has this pandemic affected our young children and how it has affected those individuals who are responsible for caring for our young children, including our teachers, educators, childhood caregivers, and our child serving systems. And then lastly, what can we do? So hopefully I'll offer you some tools and some strategies that you can kind of consider and take back to your respective units and teams as suggestions for those individuals. Next slide, please. So again, just really talking about some of that national data, we know that this has taken a huge emotional toll on virtually everyone. literally no one is immune, right? It has been, this pandemic, this global pandemic has been ubiquitous in terms of its effect on Americans. There are some, differences, perhaps regionally or between different states, but overall, most people have been affected in some way, shape, or form. And in fact, last year in 2020, the American Psychological Association conducted a national survey, and the results of which indicated that so many adults, particularly young adults, are really stressing and experiencing emotional distress as a result of this pandemic. And you can see some of the statistics there outlined on this slide. And alarmingly, we've also seen an uptick in suicidal ideation, again, across the nation, secondary to this pandemic. And as Janet just highlighted, we do know that individuals who are in the service industry, which is largely minorities and largely women, have been disproportionately affected. And also, Black and Brown communities have been largely disproportionately affected in terms of those who have contracted the virus as well. So collectively, this has just taken a huge toll on our communities. Next slide, please. So again, I just wanted to very briefly kind of remind you about the seminal study that was done between 1995 and 1997 by an insurance company in Southern California, Kaiser Permanente, in collaboration with the Centers for Disease Control. Again, most of us in the education or the behavioral health space has heard of this study, the ACE study, and it was done with roughly 17,000 members, again, back in the late 1990s, with a largely middle-class, educated, insured population of individuals. And what it found is that over 60% of the members of this insurance company had experienced some sort of adverse childhood experience. And what they found is that the more adverse childhood experiences an individual had, the more likely that that person was to have poor chronic health outcomes. We're talking physical health outcomes like diabetes, heart disease, COPD, all of those kinds of things, right? And so this study has been replicated hundreds of times. So there really no longer is any dispute about the connection between adverse childhood experiences and long-term health outcomes, right? And then in 2017, another researcher said, it's not just these adverse childhood experiences, there are these other conditions that sort of underpin adverse childhood experiences. So you can see from the diagram, the branches of the trees and the leaves reflect those adverse childhood experiences that are on the ACE questionnaire. For instance, most types of abuse, substance abuse by parents, domestic violence within the home, homelessness, parental divorce, all of those kinds of things. And again, this other researcher in 2017 said there are adverse community environments that also affect those adverse childhood experiences. And some of those conditions are discrimination, community disruption, lack of opportunity, poor housing, poverty, and so on and so forth. Next slide, please. And so now, on top of all of that, we have adverse childhood experiences, we have adverse community environments, and now we've layered on top of that a global pandemic, right? And so we can see why this is having such a huge emotional toll for, again, virtually almost every population in the United States of America and really globally as well. And for those individuals who have higher ACE scores and are more likely to be adversely affected by some of those community conditions as well, like discrimination and poverty, what we're seeing is the outcomes are worse for those populations as well. And so this ties in nicely to the next slide. Thank you, Sam, where we're talking about what impact has this had on our young children, right? And so this is hot off the press. This report literally just came out. It was the 2021 North Carolina Child Health Report Card. And within that health report card, they talked about the impact that COVID-19 is having on our children and their caregivers here in the state of North Carolina. And I'm just going to read an excerpt here from the Child Health Report Card. It says, as many families try to find their footing, The pandemic is putting a harsh spotlight on the deeply embedded barriers that create massive racial and economic inequities in health and well-being. Children are quite resilient by nature, we all know that, right? But when parents lose jobs or incomes, as so many have recently, it can cause a cascade of other traumatic events for children. Again, this ties very well, nicely back to the diagram I just showed you in terms of adverse childhood experiences coupled by those community conditions, now again layering on this global pandemic on top of that. And kids have had difficulty figuring out technology platforms and learning in this new to them format, particularly younger children, right? So what we're seeing is that some young children, not all, right, but some young children have really been struggling, right? So we've seen upticks in the number of parents reporting that young children are experiencing worry. Those who are experiencing some sort of fear, like fear about the virus, especially since they're having to wear masks, and they know what some of the implications are if someone gets sick from the virus. Grief and loss. Some of our young children have lost family members to this virus, whether it be older relatives, grandparents, aunts, or uncles, right? We also see some children become a little clingier, right? Subsequent to the virus and all of the different things that come along with it. We've seen upticks in sleep problems, kids who are frustrated, a little bit more irritability. And again, this doesn't suggest that all children are experiencing this, but it would not be abnormal for us to see these kinds of presenting issues in young children secondary to the pandemic. Next slide, please. And then related to that, I don't know if many people have ever heard of the term compassion fatigue. You may have also heard a term titled secondary traumatic stress. But the reason I wanted to highlight this is because our caregivers, again, Janet talked about this so beautifully, our caregivers of young children, as well as our K through 12 teachers, could very well be experiencing something related to compassion fatigue. Because remember, through virtual learning, they're not only obviously trying to educate children in this new platform, but they're also seeing a window into that child's home, right? And so we have heard anecdotally about teachers saying, I see, children trying to take care of their younger siblings while they're also trying to learn, or, parents who don't necessarily have the resources and are having to leave some younger children. And, obviously, given the circumstances, I understand why this has happened, but children who probably are better suited to be in a childcare setting instead of being left home alone. Some of them have been left home alone. And as you all know, again, I work for DSS. Last year, in the beginning of the year, we actually saw a precipitous drop in the number of referrals to child welfare. And why did we see that? Because kids weren't in school, because kids weren't going to the pediatrician's offices, right? Children were literally being removed from the community. But as we reintegrate children back into society, what we predict on the child welfare side is that we're going to see the pendulum swinging the other way, and that we're now going to see an uptick in the number of children who are referred to child welfare for concern related to possible child maltreatment. And this, again, wouldn't be unique to Mecklenburg County. Really across the nation, child welfare agencies are preparing to sort of see this uptick in the number of referrals as children are reintegrated back into the school setting. But getting myself a little bit off topic and getting back to the whole concept of compassion fatigue, I think it's really important for educators in particular to think about and to consider the possibility that all of the different things that have gone on and been coupled with their attempts to pivot and to teach children differently over the course of the past year may have caused some undue stress for them. And a definition for compassion fatigue in the behavioral health field is the experience of short-term exhaustion and traumatic stress reactions associated with exposure to the suffering of one's clients. And in the educational realm, we can take out the word clients and plug in students, right? And so next slide, please. It's important for our educators and other child care professionals to really be cognizant of what are some of those signs of compassion fatigue? Next slide, Sam. What are some of those signs of compassion fatigue? What do I need to be looking out for in myself or my colleagues, right? Because we definitely want to live as a community and to kind of help each other out by kind of pointing out when we think our colleagues are struggling a little bit. So here are some classic warning signs of compassion fatigue. Mental and physical exhaustion, and I'm not just talking about being tired one day, I'm talking about day after day after day, really not being able to recuperate even after getting a good night's rest or, sleeping for 8 hours, but you're still feeling really exhausted mentally and emotionally and physically. That's a sign of compassion fatigue. Using alcohol, food, or other substances to relieve stress and to comfort yourself, that might be a sign. Trouble sleeping, feeling numb and distanced from life, feeling less satisfied by your work, moodiness or irritability, or even physical complaints. These are all kind of signals that, hey, I might need to kind of take a step back and do an assessment because I may need to do some things differently in order to help me cope better during these unprecedented times, right? And we also want to, next slide, please, Sam, sorry about that. Thank you. So now we also want to think about what we can do for our children and what we can do for ourselves. So here are just some things that I'd like to offer to this group in terms of things that we can do for our children to make sure that they are able to utilize great self-regulation skills, right? And also to reassure them that this is a difficult time for everyone, right? We don't expect them, we need to show children grace just as we need to show each other grace, right? And so behavior problems or even some regression in behavior, for instance, if you have a child who has been potty trained for a while and now you're seeing some bedwetting, or if you have a child who kind of weaned him or herself off of the thumb or the pacifier and is now kind of regressing back to that, giving these children some grace because it has been really difficult for everyone over the course of the past year. And then also really equipping that child with better coping skills. So one of the things that we know that really builds resilience and coping in children is having a strong relationship with at least one competent adult. That's absolutely essential, right? So whether it be a parent or a teacher or another family member or neighbor, every child needs that one person, that one go-to that really helps them feel loved and nurtured and supported and fosters a sense of belonging to someone. So that is absolutely essential. We also really want to encourage children by nurturing their skills and their talents, allowing them to feel some control over their lives, because right now, so much probably feels outside of their control. So any little ways that we can empower children to feel some level of control over their lives would be absolutely phenomenal. And then also fostering that sense of belonging. And I realize that's been very difficult, especially over the course of the last year, because so many of our pro-social and extracurricular activities have been canceled, right? I know for my own child, I have a 5th grader. One of the things that I've done for her is try to think of how I can keep her connected to peers through virtual activities. So she, for instance, she still participates in her church choir and then just do it virtually, right? So that was an opportunity for her to still feel like she belonged to a group, even though she's not able to meet with them in person until later when things have cleared up a little bit. Also, good sleep hygiene is so, so critical. I'll tell you, that's one of my big soapbox issues for children, because I do think just chronically our children are not getting enough sleep. And so I really encourage parents to ensure that children are getting sufficient amount of sleep, and that we're doing things like making sure that we're setting them up for good sleep practices, not only during childhood, but for the rest of their lives by using good sleep hygiene practices. Good nutrition is also important. And I'm a huge fan of mindfulness for children. And the research bears this out as well, not just for children, but for adults as well. Mindfulness is effective in combating mood problems, symptoms of anxiety, worry, frustration. It's extremely effective. And so later I'm going to give you some resources and some tools related to mindfulness for children as well as adults. And then also just to acknowledge that this has been hard, right? Praising children, offering lots of praise, being patient, showing them grace, validating that this has been a really tough time for all of them, establishing a routine. These are all things that we can do to ensure that children really build that resilience and can rebound from this experience. Next slide, please. And what can child care professionals do? Similar kinds of things. Adults need to make sure that they're getting enough rest. They need to make sure that they're eating well. Try to exercise. I know it's easier said than done, but try to exercise daily for at least 30 minutes. Research tells us that exercise is an immediate mood booster. So if you want an immediate boost of endorphins in your brain, which is the hormone in your body that lifts your mood, go for a run, go for a brisk walk, get on your bike. That will immediately help you feel better. Limiting media exposure is also really important. Monitoring use of mood-altering substances, again, practicing that mindfulness and connecting with other loved ones and colleagues is really important. And then if you're still really struggling, please seek professional help. That is so key. Next slide, Sam. All right, so I'm going to end my presentation today with just talking about some of the resources that are available. And I'm going to also include some links to a lot of different resources in the chat box so that you have them at the ready. But there's a lot of great resources through the National Child Traumatic Stress Network, and I'll include some of those links in the chat box. Also, Mecklenburg County, with the approval of this board, Board of County Commissioners, as well as County Manager Diorio, have allowed us to launch a behavioral health response to the COVID-19 pandemic in our community. The initiative is titled MEC Hope, and the website is mechhope.com. So you can go to mechhope.com and find a plethora of different resources and services that are free of charge right now to Mecklenburg County citizens. We launched MEC Hope back in the fall of 2020, and recently this board, as well as our county manager, approved us to continue this initiative through the end of this calendar year. So these services, which do include free counseling, will be available to Mecklenburg County citizens through December of 2021. In addition, I saw one of our new colleagues on the line earlier, Kim McGregor from Sid Kimmel, but we're also incorporating some additional services with MEC Hope that are specifically targeted towards students. So Sid Kimmel will be doing some social emotional learning support for our K through 8 students. And then we have another vendor, Teen Health Connection, as well as the Spark Network, that will be working with our older youth to equip them with some skills and some tools to help them self-regulate. Also, Mental Health America has a plethora of different wonderful resources. I encourage anyone to go to their website. They're also offering free counseling services through MEC Hope, and they also have just a wide range of different resources on their website. Promise Resource Network is another one of our MEC Hope partners. They are actually providing services through a warm line. So that is the number to access, their warm line is the number to access MEC Hope services. So I'm going to put that number in the chat box as well, and you can contact them. They will kind of do a little bit of a screening to see what kinds of services are needed and then make referrals as appropriate. Also just wanted to highlight some other mindfulness apps that I think are really, and tools that are really helpful. Mindfulteachers.org has lots of great strategies that can be used in and outside of the classroom for teachers as well as students. Also, Tools for Peace, Stop, Breathe, and Think is an app that's wonderful. Calm app, the Breathe app, that's not a misspelling, that is exactly how the app is spelled, with 2 E's instead of an E and an A. And the Headspace app are other resources for mindfulness. And again, I'm going to put some other resources in the chat. And thank you so much for this time today.
All right, awesome. Thank you again to all of our thought leaders for your presentation. So we're going to jump right into the questions. And for the sake of time, I do want to ask our thought leaders to keep your answers possibly 45 seconds to a minute, because we do want to allow the audience an opportunity to ask questions also. So we want to infuse that into our town hall today. So I'll kick off the questions. I will pose this question to Janet, to Ms. Singerman and Ms. Dean to kick us off. So the more schools see parents as partners, not barriers, the better we will collectively serve our students. So the question is, what are families' needs and how are we working with them to collaborate? Ms. Singerman or Ms. Dean?
I'll be happy to jump in, and then Tranisha. You know, families' needs are as complex as one could imagine, right? Especially families of young children. Families, I always say, of young children are in their early earning years, but children are typically in their early learning years. And so, just like any young parent, you know, you're struggling with lots of variables: how to be a really great parent, how to provide for your family, how to understand your child's development, how to partner to just enhance the well-being of your child and your family, and how to reach out to get help where you need it. And I think that the role that child care workers can have and our system can have is really to create opportunities and to welcome families into programs, to really have a partnership, engage in a partnership with families as their children's first teacher, and help them to connect to other families and the resources that exist across the community. It's a really short answer. It's a really big topic, but it is around how we engage and really respect a parent's voice, the family's roles, and see the assets that families bring to the table for themselves, for their children, and build on those assets by reaching into the community to leverage resources and information and connectedness.
All right, and I'll just add to that, speaking specifically for what we've done with our MEC pre-K program. I think first and foremost, as Janet mentioned, that we need to build that community with our families, their partners. But we also need to be able to provide information to families to know that their children are being served in a safe, nurturing, and educational environment. We have to build that confidence. And then communication, as I alluded to earlier, is key. We have to be open and transparent with our parents. Our center directors and teachers in our program have communicated regularly with families throughout the school year and definitely throughout the pandemic. You know, whether it be posting a family newsletter, e-blast, sending a text message, using, you know, certain apps such as the Remind app, but being open and transparent about the operations that are taking place. Again, our facilities were Fort Knox. We were not allowing anyone into them. So imagine you sending your child into a childcare setting, not knowing what's on the other side of the door. So again, being transparent, sharing those moments with families has definitely been helpful. In the spring, we had to pivot again to virtual instruction for families, and they struggled with that. They were used to that hands-on interaction, but what did we do? If that means pick up the phone, calling a family, again, meeting them at the door, we made sure those lines of communications were definitely open. And then again, education. We have to educate families as well. So whether that's be posting things or on our social media accounts, bringing in experts. Again, we brought in our medical health experts to provide a Q&A session for our families so they could access answers in reference to sending their child into the childcare sector during this pandemic.
Thank you. Dr. Govenhunt, I know you said you wanted to jump in on this one.
Yes, absolutely. And I just want to reiterate the fact Janet mentioned that this is a complex, family engagement is complex. It is complex, however, it is absolutely necessary. It's not one of good practice. High quality, intentional family engagement is one of equity as well. We actually believe family engagement is a high impact strategy that spans across many times, many settings, many organizations across the community. So it's all of our responsibility. I think it's very critical that we remind everyone, because we all have a part in this, that we have to use a strength-based lens. And I think both of Tranisha and Janet just mentioned that as well. We have to use a strength-based lens when we're talking with our families, talking to our families, talking about our families, and stop making decisions for them. We walk into these spaces all the time assuming that we know what people need, and we oftentimes forget to ask them what they need. We have to start treating our families as if they are the experts in their children, because they are. And the good start to high quality and intentional family engagement will be to start by meeting them where they are and asking them, what do you need? What can I do to help you? Stop making assumptions about what people are experiencing.
Thank you. Before I go to the next question, I do want to share with our audience, if you have any questions, please make sure you put them in the chat. We will have an opportunity to try to grab a few of them as we go along. Ms. Ingerman, I'm going to pose this next question to you, looking from a holistic perspective. What should the priorities for childcare providers or the sector as a whole be for people to be more vaccinated? Do you believe all providers should mandate that their employees be vaccinated, or should it be an option to them? I think you're on mute.
There we go. I guess I would say this. I personally hope as many people in our country and world get vaccinated as are comfortable doing so. I think it's an individual choice and a personal choice. And I think there are lots of really strong reasons to be vaccinated. And I think our role is to bring information forward, which we've been doing as Child Care Resources, also in partnership with Smart Start, bringing information forward, eliminating barriers to access, bringing new information forward as new information comes out. And I think personally, the more folks that become vaccinated, the more our public health will improve, and the safer our world will be. I do respect that individuals have to make their own choices based on their own perspective of this issue and their concerns about vaccine. But we are strongly encouraging and promoting information about vaccine, access to vaccine, and connecting folks to vaccine and eliminating barriers to access. And so I think that's what we really have to do. And I have certainly said to our team and to the childcare community, for those who are sure they want to get a vaccine, we want that to happen. We will do everything we can to help make that happen. For those who are unsure, we want to bring forward that information to the extent that that information is available, to promote awareness and debunk myths, and frankly build trust. And to those who say no today, tomorrow is another day, and perhaps as more and more people are vaccinated, trust will build and security around vaccine will increase. And so no, right now, we are not looking at mandating vaccines. We are looking at encouraging and promoting and eliminating barriers to vaccine. We want to respect individual choice, and we want public health across our community and state and nation and beyond to improve. And we think vaccine is a key way to do that.
Thank you. Does anyone else on the panel want to take about 30 seconds to address the question? Right,
I'll just add,
move on.
Sorry, I was just going to add, I definitely support what Janet mentioned there, that I don't support a mandate for anyone to have to get a vaccination, but I think the key is definitely, it goes back to education. Our last teacher work day was last Friday, and Dr. Meg Sullivan came on, and I think this was probably her toughest Q&A session with our public pre-K teachers, and it was really around the vaccination, the education of the three that are available. Again, the access to that. So I think it's education. I think we had some folks. We did a quick survey going into our session, just asking how many of our teachers have been vaccinated or undecided. So I think we had an hour and a half in-depth conversation and got some feedback from teachers after that saying, you've educated me. I was on the fence and now I'm convinced that this is something I should do, not just for myself, but for the families, the teachers, and the community that we serve.
And Sam, I would just add, if I may, that Child Care Resources was asked to and has called every single licensed child care program in Mecklenburg County to make sure folks have access to information, access to a spot for their shot. And we are continuing to work with Smart Start and the health system, the county public health system, and our vaccine providers to ensure that there is access for the childcare workforce in times when the childcare workforce can be vaccinated, because as you know, teachers are in classrooms every day, and family childcare providers are with children to 12 hours a day. And so we want to make sure that there's access when our workforce can actually be outside of the classroom and outside of the family childcare home. And so we're trying to eliminate those kinds of barriers.
Great, thank you. So during this COVID pandemic, as we all know, little attention has been paid to the kids and the impact it has caused on our babies. I think Dr. Puletti during her presentation kind of touched on some of the impact that is happening, right? So some educators have voiced their concerns about the importance of kids being around each other throughout this whole pandemic. So my question is, why is early childhood educators' work viewed so minimal compared to others? And I want to kick this off with Dr. Govan Hunt, if you can start this off, and then I'll pass it on to Ms. Dean.
I'm sorry, Sam. How many seconds you wanted us to take? Because that we can stay in this spot forever. And the short answer to that question that we often hear, we hear over and over and over again is, I have no idea. We have the research that shows that these people are doing brain work. They are doing more. They're not babysitters. They are actually growing and working with families to lay strong, solid foundations for children before they begin their formal academic career that's entering in the kindergarten. We have got the numbers and the research that shows that investing in early childhood education, and I'm talking about including our family childcare homes, I'm even talking about family, friends, and neighbor care, Sam, that this is one of the highest returns on investment. So why do people look at their work the way that they do? I have absolutely no idea. The best answer I can come up with is priorities. Priorities, priorities, and priorities. We invest our time, our money, our skill, our passion, and even our levels of respect in other areas that we have high priorities for. So if somebody decides to make up their mind and understand and learn more about what happens in an early education classroom, what happens in this field, and actually takes the time to realize and open their eyes that this economy is not going to get back on track without the early education providers, without early childhood education, without helping these people advance the work, the wheels are going to continue to fall off. Why do they pay so little respect to it? I have no idea. That's a short, I have no idea. I don't, because all the research is there. It's accessible to people. We have folks like Ms. Dean, Ms. Singerman. We have people like actually reporting on these numbers all the time. They eat, breathe, and live this stuff, and they're sharing this information on the local level, on the state level. This information is being shared across the country on a national level. People just have to make up their minds and say that whatever it is that they want for their own children, their own grandchildren, the same greatness they want for their children, they have to want it for everybody else. They have to want it for everybody else, or the system will just continue to fall apart.
I see a lot of head nodding as you were speaking, so that must have hit a sweet spot on everyone. Ms. Dean?
How do I follow that, Ms. Govan Hunt? After she said it all, but I think if nothing else comes out of this pandemic, it's the fact that, again, parents have had to be with their children 24 hours a day for multiple months at a time. If you don't give the respect to these teachers that have 18 children in their classrooms or greater, just with a co-teacher, you have to respect the work that they're doing. So if nothing else comes out of this pandemic, it's the fact that, again, I have to respect the child care sector, and having an opportunity to place my child in someone else's care. We dealt with, at the beginning of the pandemic, or even going back in school this year, families that were on the fence. I've elected to give up my slot because I'm not comfortable sending my child. Within just a couple of weeks, we had families reaching out saying, I have changed my mind. I need to get away from my child. They need to be in your care. So again, if nothing else comes out of this pandemic, I feel like a little bit of respect and acknowledgement is out there for the child care sector as a whole, and the work that they do to support not just pre-K children, but again, the whole child care sector from birth through 5 as well.
Yeah, there's a question in the chat, and I think it's kind of a follow-up question to this, but maybe a little bit on the other side of the spectrum. And I'm going to read that question very quickly. It said, "How are children of English as their second language (ESL) families in our immigrant and newcomer communities that make up a huge part of our essential workers? How are they being supported?" And any of our thought leaders can take that question. So how are children in the immigrant communities being supported?
I'll start here, and I know that Dr. Goen Hunt is a member of the Charlotte Bilingual Preschool, but we have a partnership with the Charlotte Bilingual Preschool who houses 4 of our MEC pre-K classrooms. We partnered with them last year, and again, their targeted population is serving the Spanish-speaking community. So the support that they are providing to their families and also to the teachers that support those families have really come through with that. We are supportive to our providers to provide support to our children and also to our teachers. So huge emphasis and support has gone into supporting that population or families. We do have multilingual families across our program and our sector just in general. So we still connect them with other partners such as, again, childcare resources or other resources that are out there. But that's our largest, I would say, immigrant or non-English speaking community. And that support, they do so much great work with, I like to say hand holding, and not in a negative way, but really supporting the families and getting them to the finish line, whether it be food insecurity, whether it be transportation issues. They have really stepped it up this year. Their campus is located at a public school facility, and with the schools being closed the first half of the year, they were stopped. What do we do in a sense? So they were able to partner with another child care community on the other side, in the west side of Charlotte, to still support those families. What can we do to provide that support and that care to those children in that program?
And I'll just lift up Smith Family Wellness, which is a nonprofit integrated medical practice on the east side of Charlotte. It is supported by the Steve Smith Foundation. They serve a lot of families who are being bilingual and serve the immigrant and refugee population. So just wanted to lift them up as a resource for medical services as well as behavioral health services.
Mm-hmm. And really quickly, Sam, I wanted to point out the fact that the work that Trinisha just lifted up at the Charlotte Bilingual Preschool of how they're serving these families has a lot to do with what we like to call their secret sauce, what some might call and what they've identified as comunidad, which means that they look at the whole child. So supporting the communities that was just pointed out in the question, complete wraparound services. Like she mentioned, it's not just making sure that families have access to resources, but it's really working with them to build their community, to build on their comunidad, to support each other and deliver culturally responsive and relevant resources and support systems. So even when lifting up their programs and taking it to another center across the town, that part of the service was never lost. It was never lost. Actually was amplified. And so BCDI likely make sure that we actually, when we come in contact with those families and we get requests for those types of services, that we point them into the direction where we know that they'll get what they need.
And let me also add to that really quick as well. Again, as a new startup program with MEC Pre-K, we are still learning. So I feel like we are learning from programs such as Charlotte Bilingual Preschool to better support their families, the staff, and then their teachers. They have a bilingual team of teachers. How can we better support you? Our curriculum that we provide, the Creative Curriculum 6th edition, we purchased the Spanish version just to better support our teachers in supporting that information to our children. So I just want to say that we are always open and we're learning to better improve our support that we provide. And I also want to recognize the YMCA and the Parents as Teachers program. Pilar and her team are fabulous when it comes to whether it be translating or partnering. They have been awesome with providing that additional support when it comes to supporting families of the Spanish-speaking community.
And I just want
to... I saw you came off mute. Can you do like 30 seconds for me? Because I want to go to Dr. Pugh-Lilly.
I guess I would just say, and we can do much more. Because we have we just have a handful of dual immersion classrooms. We have a workforce shortage, which makes this challenge. We need to recruit more early education professionals to really enrich and extend the really strong base that's being built by Charlotte Bilingual Preschool and our community to serve families and to meet the needs of these families. But much more can be done.
Thank you. Dr. Pugh-Lilly, if I could come to you for a few seconds. So middle and high school students are able to work more independently and from a distance. Unfortunately, our elementary school students, especially pre-K to second grade, are at a higher risk or greatest risk in this environment. We know it's very important that school invest into this demographic. How are we redirecting resources to support kids that are in K-2 navigate through the issues caused by the pandemic?
Yeah, as I touched on just briefly during my presentation, it has been more difficult for younger children to pivot to learning virtually versus older children who are a little bit more accustomed to using different tools and strategies and mechanisms to learn in the classroom. We have seen a lot of K students, kindergarten students, first grade students who've really kind of had meltdowns and outbursts as in respect to ongoing and long day virtual learning. So again, I just wanted to highlight some of the services. Well, first, again, I think it's so important to recognize that and just to, share with children that this has been difficult and praise the opportunities to offer praise when there are opportunities to offer praise to those children, praise that positive behavior, praise when they are sitting still and focusing and paying attention during the virtual classroom setting. And again, acknowledge that this has been really difficult for them and that there isn't anything abnormal about them because it has been so difficult. And again, I just wanted to lift up the services that the county is supporting. As I mentioned before, the social emotional support services will be available beginning on April the 1st. And those can be accessed through the mechhope.com hotline. And I did put that, warm line, and I did put that phone number in the chat. And again, it'll be Sid Kimmel will be providing some social emotional support to some of our younger children. And then we also have two vendors who'll be providing some emotional and behavioral regulation support to our older kids as well.
I do have one more question. I know we are short on time. So if you guys could answer that question in literally 5 seconds, but I would love to hear the panelists' thoughts on this next question, but please, 5 seconds, don't get into too much detail. How can teachers and parents leverage their time over the summer to catch our kids up on their learning? So if each of you can just answer that in 5 seconds, I'll appreciate that.
All right, I'll do it in 5 seconds. Summer enrichment packets will go home to the public pre-K sector, Met Pre-K, NC Pre-K, Bright Beginnings, and Head Start. Secondly, partnership with Reach Charlotte, there is a new text feature called Ready for K. Sign up for that. And also Met Pre-K families have Ready Rosie, and they will continue to receive those notifications over the summer as well. I'll stop.
Sam, I'm going to, let's see, 5 seconds. Okay, so families, we're going to encourage families to utilize a tool that Read Charlotte has made available to us called the Reading Checkup. Give your children a reading checkup. And when you get those two scores from your code focus and meaning focused assessments, contact BCDI Charlotte so that we can help you implement the activities into your daily lives. Read with your children, read with your children, and have some rich conversations about the books that you're reading.
And I'm just going to echo what the other panelists have already said.
And the only thing I do too, and I would just add, childcare is a year-round experience. So read year-round and engage in the learning opportunities in childcare year-round for your youngest children.
Thank you. Now, before I bring back our county manager, Dina, I just want to say thank you to our panelists for this opportunity to learn and to pick your brain. I hope the audience were able to grab or to get a lot of good information from this. I do see more questions in the chat. We'll try to capture those questions and present those to our panelists and hopefully get some answers back. to the group. And then lastly, I just want to thank my co-chair on this specific town hall, Ms. Brenda Campbell, for all of her work and bringing this idea forward, and everybody in the background who really helped to make this possible. So, Dina, I'll turn it over to you. Thank you also for this opportunity.
Thank you so much, Sam, and thank you to all the panelists. I do also want to point out that Jennifer De La Hara, as one of our school board members, is also joining us tonight. I want to thank her for being here. What a great conversation. These panelists were awesome. We have Dr. Govan Hunt, who is a huge advocate around respecting and empowering families. I love that. Janet Singerman, your support of the industry and our teachers is unbelievable. Trinisha, you are the architect of our MEC pre-K program, and you have changed the landscape and early childhood in this community, and I cannot be more grateful. And Dr. Elise Puglioli, given us some great things to look for in our young children, as well as some resources and tips. We are so blessed to have all of you as part of our community. Thank you so much for being here. It is now 7:30, so we will end this town hall, but please keep in touch with what the task force is doing. They're doing some really great things, and I know the board is really excited about the work that's going on, but please join our meetings and give us feedback. I know the task force would really appreciate it. So thank you so much. I really appreciate you being here tonight. Thanks.